Say goodbye to dull learning. Our interesting videos make studying enjoyable. Nerve supply of the face. Let's begin with the motor nerve supply. This refers to the nerve or nerve fibers that provide the necessary stimulation to activate and control the movement of muscles, mainly the facial nerve. So where does this facial nerve come from, you might ask? It originates from the brainstem and travels through a narrow bony canal in the skull, called the internal acoustic meatus. It then exits the skull through the stylomastoid foramen. From there, it winds around the styloid process and finally enters the parotid gland, the saliva factory in the face. But we're not done yet. The real magic happens at the parotid gland's anterior border, where the facial nerve splits into 5 terminal branches. That's right, 5. And they've all got fancy names. The temporal, zygomatic, buccal, marginal mandibular, and cervical branches. So what do these 5 branches do, you might ask? Well, they emerge in the face and supply the muscles of facial expression, which is a fancy way of saying they are the reason you can make all those funny faces in the mirror. And if you're feeling particularly bored, you can try to remember the 5 branches by placing your palm on your auricle and spreading your fingers. So, to summarize, we have the facial nerve, from a hole in the skull to a fancy dinner party to a secret handshake. Time for some fun facts. Did you know we have hundreds of such videos, mind maps, and notes? Go on, download our app and get access now. Let us look at the clinical significance of the facial nerve. When the facial nerves aren't performing at their best, things can get weak, and that's where Bell's palsy comes in. Bell's palsy can strike without warning, causing facial paralysis on one side of your face. And while the actual cause is unknown, it's thought that a viral infection is to blame. As the facial nerve becomes compressed close to the stylomastoid foramen, the lower motor neurons that control your facial muscles start to misfire. One of the most noticeable symptoms of Bell's palsy is facial asymmetry. The damaged side of your face is attracted to the healthy side, causing an uneven appearance that can be difficult to ignore. As the condition progresses, you may notice a reduction in your horizontal forehead creases. Your palpebral fissure may start to widen, making it difficult to seal your eyes shut, and tears may start to run down your face due to paralysis of the lower orbicularis oculi muscle. As the zygomaticus major muscle becomes paralyzed, the angle of your mouth may start to sag on the affected side. You may also notice a loss of the nasolabial furrow due to paralysis of the levator labii superioris alici nasi, and food may start to build up in the vestibule of your mouth due to the paralysis of the buccinator. And if that wasn't enough, you may also experience saliva dribbling from the corner of your mouth because of the paralysis of the orbicularis oris muscle. But the good news is that in most cases, Bell's palsy is a temporary condition that resolves on its own within a few months. The treatment options available reduces symptoms and gives the patient confidence. For a more interactive way to learn, check out our app and website. It's packed with notes, mind maps, and everything you need to ace your exams.